Welcome to the Asian Pain Academy. Today I'll be describing a condition which is known as the proximal intersection syndrome. A few days back, a lady of 50 years came to me with a pain which is close to the wrist, but which is a little bit proximal to the wrist. Usually, if there is a pain, we usually consider the possibility of the dequervance tenosynovitis. But for this lady, the pain is not here. Rather, it is slightly proximal, around 3-4 centimeter proximal from that end, and there is a mild swelling, and the patient is having pain for around 1 month. Initially, she has taken NSAIDs and other anti-inflammatory drugs almost for a month, but still the pain is persisting, and the patient came to me for the pain management. Now, what we have seen when we have scanned it under the ultrasound. When we scan under the ultrasound, we have seen it is exactly over where the compartment 1 is crossing over the compartment 2. So this condition is known as the proximal intersection syndrome. So we have scanned, we have found this is the compartment 1, this is the compartment 2, and there we have the listus tubercle. Then we have after the listus tubercle, we have the compartment 3. These are the dorsal compartments. Here you can see this is the extensor retinaculum. Let me first hide the extensor retinaculum. These two are the abductor pollicis longus and the extensor pollicis brevis. They are in a common shape that is known as the first compartment. And usually when there is inflammation in between, that is the dequervance tenosynovitis. But here the condition is slightly different. Here the pain is occurring at the junction when these compartment 2 tendons are crossed by the compartment 1 tendons above. Among the compartment 2 tendons, we have the extensor carpi radialis longus and extensor carpi radialis brevis. So if there is inflammation at this point of this intersection, this is known as the proximal intersection syndrome. And if the pain occurs at this point where the compartment 3, that is the extensor pollicis longus, is crossing over the compartment 2 tendons, this is known as the distal compartment syndrome. And here is the listus tubercle. Just now we have seen the scanning from this area to this area. But we have seen initially there was this compartment 1 crossing over towards the lateral side and from over the compartment 2, and the pain is exactly at that point. So what we did, injection of the corticosteroid at the site of the proximal intersection where the inflammation is. So we have under the ultrasound, we have focused our needle and we have passed the needle at the intersection point, and we injected 20 milligram of the dipomethylprednisolone under ultrasound guidance and then get back. So it's a simple technique, but you have to do it under ultrasound so that your needle tip never enters within the tendon. It should be either in the sheath or in between the intersection so that the tearing of the tendons or injury to the tendons do not happen, which is common if you are doing an unguided injection there. So this is the technique. I hope you enjoyed this video. And if you like this video, you can subscribe to our channel, Asian Pain Academy. Thank you.